Oh, this is Rob, your stretch therapy coach. I help people move better and feel better. Today, I want to talk about what is the best release for your IT band. To be honest, it's not a stretch, and it's foam rolling. So I want to show you some techniques from the Roll Stretch program. We're going to think about the IT band that runs below the hamstring and the quadriceps on your leg. So we need to apply a lot of pressure on there. So I recommend using a foam roll for that. This is a softer roll. They go into a harder foam, and then they get even harder into ones with little nubs on them as well. What we're going to do is, I'll use the more advanced one, but if you're new to foam rolling, I recommend starting with a nice soft one. I introduced the foam rolls 20 years ago, and it was very powerful. It does get better, it does get easier. Just like everything, we need to follow progressive overload, starting with something that's soft and working your way up to something that's a bit more advanced. Same techniques we use for massage therapy. We're trying to release this connective tissue, allow the muscle fibers to move freely. In our classes, I teach you the contract relax technique to do that same process. But I find the IT band foam rolling is far more effective than the actual IT band stretch. So what we're going to do is we're going to place the roll of your choice, and we're going to have a seat on it. We can stack the legs. I'm going to roll from the hip or just above the knee. Just going to go up and down. And they say we should do this about 70% of the pain dissipates. Now, if this is too powerful for you, we can place that top foot to the floor and just roll up and down. I'm trying to find the tender point, find a little spot we can focus on that spot. Now, there's two types of techniques we can use. The one I just demonstrated, we kept it dynamic and moving. This is great if you're about to work out. You might be feeling stiff and sore. You're at the gym. You want to train. You want to keep it dynamic, keep it moving. It stimulates muscle contraction, draws blood flow into the area. Now, if it's at the end of your workout, or you're not going to work out or do anything active, you use a melting technique. Where we're just finding the tender point and we're stopping in that position. We're letting that tension melt away. But again, if you're about to work out or do something active, keep it dynamic, keep it moving. If it's the end of the day or after your workout, use that melting technique. Let me know if you have any questions.